Hello, this is Dr. Brian Petrie from Regenerative Medicine of Raynham, and I'm back here with David, who underwent a regenerative medicine procedure, which we performed on January 29th, so it's been exactly 1 month since we did that procedure. And in the link below is the initial interview that I did with Dave that he talked about the symptoms that he was having prior to doing the procedure. And today is a 4-week follow-up to see how Dave made out. So Dave, just briefly, if you could describe what you experienced, what was going on with your knee joints?
Before, I think I had talked about it, the preliminary, I had gone to an orthopedic doctor and they talked about doing surgery, giving injections first, and then I had done physical therapy. I came and saw Dr. Petrie, talked about regenerative medicine, and I've had surgeries before. I didn't want to have surgery again. My pain from doing work all the time, down on my knees, up on ladders, up on roofs, was excruciating at times. Probably 7 to 10. When it calmed down, probably down to a 5 out of 10. My ankle was 7 to 10 all the time, especially when I got out of bed. It really hurt. I had the injections in my knee. I have zero pain in there now.
Okay. So when Dave came in to see me, we determined that he had a significant degree of degeneration in both his knees, but more so on the right knee. And on the ankle, he had a severe grade 3 ligament strain on the outside of the ankle region. So we did what's called an A2M procedure to stimulate healing response. And the procedure we did on the lateral ankle was an advanced form of PRP, which stands for platelet-rich plasma, which usually when you have severe ligament sprains take quite a while to heal. So it's interesting to see the results that we got within 4 weeks we did. So what are you experiencing now, Dave, and how has it benefited you?
Well, in the knee, I have no pain.
There's no pain in the knee. It's completely resolved.
Right now, because I haven't done anything really to exercise it, other than stretching it, it feels weak in the muscles around there, but I don't have the pain that I had in the knees before at all, at no time do I have pain. In my ankle, as I said, I had a hard time getting up in the morning, getting out of bed, but now, in the morning it's probably 3 to 5. During the day, once I get loosened up, I have no pain. And then at night, when I sit down again, it swells up a little bit and I have pain at night.
All right, so it's still, your body's still healing. It's only been 4 weeks, and that healing response is still going to take place over the next several months, actually. Okay, so you're going to continue to get better, and you're going to be starting to do more rehabilitative exercises at this point, which is only going to make it stronger. Now, you did say that your passion was to travel back to Ireland and
throughout Europe and to hike.
To do a lot of hiking over there, right?
Do a lot of hiking.
So, and is that something you were seriously concerned about doing before? Because you're getting ready to retire, correct?
Right. So last summer I hiked about 13 miles a day in Norway.
Okay.
During the summer, and I really suffered it. And when I came back, I feel like I did damage to it. I didn't think that I could do it again this summer, but right now I'm pretty optimistic about it.
Okay, that's great. And you going back again?
I'm going to hike out through Greece and Albania and over more in Eastern Europe.
Okay, so you're glad you did these procedures then and you didn't go through the surgery route. Okay, all right. Anything else? Is this something that you would recommend to anybody else experience the same type of?
Absolutely. I mean, the great thing about it, and as I said, I've had surgeries before. There's no downtime. I mean, the downtime was what I did to myself. I was still cautious. You don't know if it's going to work, and I was cautious. I was afraid that I'd feel the pain still, but I haven't, and I don't anticipate that I will.
Okay, so it's something you would recommend?
I would recommend it.
Yeah. Okay. All right. Thanks for sharing your story, Dave. Appreciate it.
Thank you.
Okay. All right.
Thanks.